All right, good afternoon, everybody. We're going to start today on a positive note on healthcare. Connect is a name that's become familiar among Kentuckians. Kentucky's original award-winning state-based health benefit exchange helped Kentucky achieve the biggest drop in its uninsured rate in the nation from 2013 to 2014. In other words, it was a pivotal step to ensure that people were connected with doctors and the healthcare system, something that is hard to quantify the importance of as we are going through a pandemic. There is no question that both Connect and the expansion of Medicaid saved thousands of lives in Kentucky. And I think in the end, when we look back on this pandemic, how access was built and expanded or not expanded in different states will be part of the reason why we see loss in some places and not as much in others. So the Connect portal was relaunched last fall with information about a range of benefits and resources, such as where to apply for nutritional benefits, where to find childcare or elder care, where to get help with transportation, and much more, including health coverage options after clicking on the healthcare.gov link. Connect relaunched last October with a promise that we would take a major step forward to provide quality health care to Kentuckians by reopening our state-based marketplace. Remember, under the last administration, that state-based marketplace was resolved, and we were instead pushed on the federal exchange. Today, I'm pleased to announce that the Centers for Medicare and Medicaid Services have approved this reopening that'll give Kentuckians easier than ever access to information about health insurance coverage and other benefits. I'm also appreciative of the $650,000 in the American Rescue Plan grant funding that Kentucky will receive from CMS to support the reopening of Connect. Starting only a few days from now, October 15th, consumers will be able to head to connect.ky.gov and compare state-managed health insurance plans a full 2 weeks ahead of open enrollment, because our new open enrollment, first time in years on our state-based exchange, starts November 1st. Beginning on November 1st, consumers will be able to use the platform to determine eligibility for Medicaid or find out if they qualify for help with out-of-pocket monthly plan costs. They'll be able to apply for coverage and complete their enrollment for coverage that starts January 1st, 2022. And all of this from one convenient platform, connect.ky.gov. The annual open enrollment period will remain open through January 15th, 2022. We encourage everyone to look at their quality healthcare options, which we consider to be a basic human right. Never has the need for quality healthcare been more evident than during the COVID-19 global health pandemic. Our economy has caught fire, and we've just landed the largest economic investment in our state's history. But we cannot succeed in building the better Kentucky and creating the workforce that we need for these amazing announcements if we don't get much healthier. Connect was a lifesaver for so many when it was offered in 2013. And we're eager to work with the U.S. Department of Health and Human Services to bring it back and make sure all Kentuckians can easily access information about health plans and benefits they deserve. Now, here is a preview of what Kentuckians will see on Connect starting October 15th in the way of healthcare coverage options. I'm excited because we believe they will have more options than they would have on the federal platform. Anthem will be offering statewide coverage through Connect. CareSource will offer plans in 100 counties. Plans will be available in select counties from 2 new health insurance providers as well. Ambetter from WellCare of Kentucky and Passport Health Plan by Molina. Consumers will also see something brand new in Kentucky, vision insurance, on Connect through VSP individual vision plans. The plan will offer enrollees a comprehensive eye exam from an in-network doctor and an eye frame allowance and lens enhancements, such as progressives. Options for consumers are only part of the reason we're excited about the relaunch of our state-based marketplace. Our Commonwealth can tailor coverage to address the unique needs of Kentuckians, which is a real plus. There are certain health outcomes that we are worse at than many other states. There are some we're slightly better. We get to tailor it in the best way to get us healthy. Another benefit is cost savings. The relaunch of our state-based marketplace is expected to save Kentuckians at least $15 million a year. Consumers who enroll in health plans through the healthcare.gov site pay a surcharge on premiums, which will not continue when the state-based exchange is up and running. The savings are going to be passed to the people who actually buy off the state-based exchange. So everything the state is saving, the people are going to feel in terms of lower cost for coverage through the state-based marketplace. The health coverage comparison and enrollment advantages of a state-based marketplace will join the advantages of the Connect portal already appreciated by Kentuckians. For a year now, following the relaunch of the portal, we have helped Kentuckians access more local support by connecting them to information about where to apply for food assistance or where to find food banks. Transportation support, employment, and job training. You can find it right there on Connect. Veterans benefits, and more. Since October 2020, the award-winning Connect portal has been logged into over 2.3 million times by 1.8 million visitors. Nearly 105,000 applications have been submitted, and nearly 1 million supporting documents have been uploaded. This is a 180% increase over the daily average noticed last year from January through September. Connect.ky.gov, built by Kentuckians for Kentuckians, is ready for you to visit or to revisit to get the services that you need. Be sure to visit the portal for 2022 health plan comparisons and to pick out, if this is your route to getting health care coverage, your plan for next year starting October 15th. Incredibly exciting, a chance where we control our own destiny, tailor our plans to lift up the health of our people, save the state and the people money, and create a one-stop shop about what other support do you need. So an exciting time. I think there were at least 2 other states who relaunched exchanges that were announced today. Thank you to Secretary Javier Beshear and others at the federal government for ultimately giving us the green light to move forward and helping our people. All right, on to COVID-19. Overall, today's report is going to be positive in the trends. There is a lot of positive to take from it. But what is still really hard is the loss of life we continue to see, and that loss being preventable. And it's not just in Kentucky, it's across the country. We've now surpassed 700,000 Americans dead. That's hard. And it's going to be a scar that we as the American people carry with us moving forward. This is a huge loss of life in an 18-month period of time. These are more people than live in any city in Kentucky. It is a massive death toll. And it's important that we do everything we can to not let it continue to increase and to protect the people around us. It's also important that all of us, not just the vast majority of us, recognize the severity of this pandemic, because disrespecting 700,000 American families who've lost someone they loved and cared about is wrong. I think we all now know multiple people who have passed away during COVID or have lost family members. Let's make sure we treat and remember this pandemic for how deadly it was and how much grief we're even going to carry with us in the years to come. Reports through the weekend and through today. Saturday, 2,511 new cases, 54 new deaths, a tough day. There were a lot of younger deaths on Saturday's report. 49-year-old man from Anderson County, 52-year-old woman from Breathitt County, 46-year-old man from Christian County, 54-year-old woman, 59-year-old man, both from Davis County, 59-year-old man from Fayette County, 58-year-old woman from Floyd County, 36-year-old man from Grayson County, 58-year-old woman from Greenup, 49-year-old woman from Harlan. Jefferson County lost 3 women ages 51, 51, and 52, and a 57-year-old man. Lawrence County lost a 43-year-old man. Martin County, a 56-year-old woman. Monroe County, a 59-year-old man. Owen County, a 57-year-old woman. Again, continuing to hit people who are younger and younger. Sunday, 1,713 new cases. I'm sorry, that's hospitalization. 1,201 new cases. 1,201, 22 deaths. Those included a 51-year-old man in Hardin and a 49-year-old woman in Pike. And then today, 1,239 new cases, 26 new deaths, including a 43-year-old man from Anderson, 56-year-old man from Bourbon, 52-year-old man from Jefferson, and a 49-year-old man from Pike County. All right. That's hard. It's hard losing that many people, but there are a number of rays of hope. Today, our positivity rate is down to 9.31%. It is falling every single day, and that's what we want to continue to happen. Let's look over our stair-stepper chart. We now have 2 straight weeks of declining cases from that week that we had, we popped up a little bit the week after Labor Day. In reality, I think that if we accounted for Labor Day, people had gone in to get tested, we would be looking at 4 consecutive weeks of falling cases. Now, the drop from this last week to the week before is not as significant as to the week before that. So this is something we need to watch. We not only want the cases to drop, we want them to drop at a significant rate week to week. We want to make sure that we don't have one drop and a plateau, but right now, everything we're seeing suggests falling numbers of cases. Positivity rate, falling by a greater magnitude each week. Remember, this is the leading indicator. Cases are the lagging indicator. So this overall is good news. Remember, it is still way too high. But if it continues to fall at this rate, we'll not only be at a better place, but we'll be below the peak that we had in the fall and in the winter, much less the terrible peak that we have had in the weeks prior to today. Looking at inpatient census, hospitalizations continue to fall. Thank God. We saw this and we wondered if it would pop back up. Florida had a bit of a flare up at some point. Right now, the trend is positively negative. In other words, it is positive that it continues to go down, and we want to see this. And we're seeing it across the board. Remember, there was a time when hospitalizations looked like they had started inching down, but the ICU and the ventilators were not. They now have a clear trend downward. Let's look at ICUs, right? That is a good sign. And now not bouncing up and down, but what appears to be a downward trend. Now, we may have times where we inch up a little bit, but as long as overall it continues to decrease, that's a very good sign. And ventilators as well. This one was the last one to move, but now it appears to be moving significantly. In fact, over the last week, hospitalizations have decreased 15%. Though, you know how we talked about just a little bit of static? ICUs in the past 7-day rolling average are up just a little bit, 3%, but overall moving downward. That's how the rolling average works, and that sometimes you can have that. Now, we're on the right trajectory, which is a downward trajectory, but that doesn't mean that our hospitals aren't still overwhelmed. The relief that we hope will come from this downward movement has not hit our hospitals yet, because remember, those cases take a little time for hospitalizations and then ICUs. As of today, 62 of 96 hospitals reporting critical staffing shortages, 118 adult ICU beds open, 16 pediatric patients in with COVID, 6 in the ICU, 3 on ventilators. It appears to be sorting itself out, but last week, the provider of monoclonal antibodies did not ship on time. Turns out they later admitted to there being a shortage, but it appears that we are now getting everything that we ordered. But we are watching that closely. But another piece of good news, the orders from around Kentucky for monoclonal antibodies is decreasing and markedly decreasing, which suggests that fewer patients are coming in seeking them. But again, hospitals hit hard. Stories from our healthcare teams are heartbreaking, and the truth is we cannot continue at this pace. We have to accelerate the trends of decreasing cases and those sick enough to go to the ICU. Today we have a video from nurses at King's Daughter Medical Center discussing the dire state that they are seeing in their COVID unit. So thank you to Danielle Sexton, Carly Thomas, Rebecca Harper, and Tiffany Wagner for sharing this message.
It's hard. It's not something I thought I would see in all of my years as a nurse. I've been here for quite a few years, and the things we're seeing now is not anything I ever expected. Death and dying are a part of nursing, unfortunately, but not to this extent. I mean, this is just extreme right now.
Nobody's going to teach you this in nursing school. Ever, nowhere. Nobody can prepare you for this.
In the emergency room, we're packed full. I mean, there are days when there are 20, 30 people out in the lobby waiting for a bed. We are trying our best. We're trying our best to prioritize the patients who need to be seen.
With this surge, the patients are typically younger. So you've not had this conversation with your family members yet. I'm 43 years old. I've not really had that kind of a conversation with my husband. Should I be on the ventilator for X amount of time? When would I want to come off of it? Or when would we want to transition to comfort care? These are the talks that we're having with families right now that are hard. Unfortunately, we're not seeing them come off the ventilator to live life afterwards, after they've been wrecked with COVID.
People are not getting vaccinated for COVID and not social distancing and not wearing their mask, and they're coming in sicker than I've ever seen before. It's emotionally draining when you see people that are young and that would have lived a full life if they just made a different decision and maybe would have got the vaccine, or people that look at you and they're smothering essentially, and they literally say, if I could have done anything different, I would have got the vaccine.
At least 95% of my patients that walk out of here, or sadly that don't make it, have said to me, I wish that I would have gotten vaccinated. I think that we should trust science a little more than we are, and to stop making it so political, because it is killing people.
I think at last check, like 92% of our patients are unvaccinated. And the big difference between vaccinated and unvaccinated, if I can elaborate, is our vaccinated patients typically go home in a day or two. They've gotten COVID. It's usually an incidental finding. They're on minimal oxygen support, and they get to go home after a couple days. Whereas our unvaccinated patients are much sicker. It's much harder on them, and it's taking them much longer to show improvements and get to go home.
Once they get to this point, there's not a whole lot of conversation that we have about the vaccine other than regret. I've not seen anyone in my care that has not had the vaccine who's still standing by their choice not to have the vaccine. Every one of them regret not having the vaccine. It's incredibly hard. They knew that there was something they could do to prevent this, and now it's too late.
When our patients are in here and about to get put on a ventilator, they wish they'd gotten vaccinated. And I would tell the community, please get vaccinated. Let's get this under control. I mean, it may never go away, but it doesn't have to be this bad.
It wasn't nearly this bad. You get the first surge, I felt like God was saying, here's your warning. This is coming. Here's your time. We developed this vaccine. Here's your time to get vaccinated, work up, an immunity to this virus before it gets bad. And a lot of people ignored that. And we're losing so many people that we just don't have to, we shouldn't be losing. There's people dying up there that shouldn't be dying had they taken the help that had been developed. And that's what's hard. That's what's hard, is there could have been prevention to half of this, or most of this.
we're tired of COVID. We're tired. We're all mentally, physically drained. We're tired. But we will keep fighting, and we will be here for the community. We're just tired.
As we've talked about before, with everything these hospitals are facing, we have provided help in a number of ways. We've taken over testing from the hardest hit areas, freeing up clinicians. We've sent nursing students from schools around the Commonwealth. During the course of COVID, we've provided over a billion extra dollars that have flowed to these hospitals through either one-time settlements and or increases in reimbursements. AmeriCorps volunteers have been in, and then there's a group that has lifted spirits everywhere they have gone, and we've gotten comments on it just about every day. Our Kentucky National Guardsmen continue to serve and support our hospital staff across the state, and we're grateful for their continued sacrifice. They're away from their families and their places of employment to help those most in need. We could not do this without them. We still have almost 450 Army and Air Guardsmen helping augment our hospitals, provide mobile vaccinations, and help with our food pantry mission. This video highlights just one of the hospitals receiving such support, and we're appreciative of Second Lieutenant Lopez Chavez with sharing her experience so far.
I'm Second Lieutenant Lopez Chavez. I'm the officer in charge here for the 299th at Rock House Regional in order to support our fight against COVID-19. Everything that we do has to do with logistics, such as mostly in processing patients, making sure that environmental services gets what they need. We want to make sure that the rooms are cleared for more patients to come in, and also making sure that we can prevent the spread of COVID-19 in the hospitals as much as we can. Hospital staff love us, and we absolutely love them. They're grateful that we're here, and I really wish that I wish them the best, especially on their medical side, because we can't really help that. I know for a fact that our soldiers' morale is extremely high. They're really grateful to be helping this hospital in the fight against COVID-19. A lot of them are actually around from these areas, so they're really glad to know that they can help their communities. As far as the hospital staff and their soldiers, some of the department heads have actually offered some of our soldiers job slots because of how well that they are doing. As far as for the community and for everybody else to see, just know that we are absolutely here to help.
Thank you to our National Guard. Next up, something that we've been talking about as coming for a while. Started talking about it all the way back in initial efforts to get people back to work, and then have talked about it as well in talking about what else can we do to help our hospitals retain folks that are out there. So for nearly 2 years, Kentuckians on the front line of this pandemic have worked tirelessly to ensure the needs of our people were met. Despite the dangers, they still showed up. From healthcare heroes to first responders to grocery store workers and educators, the bravery and dedication of these essential workers has remained strong. And as we are on month 18, almost 19 of this pandemic, it's important to have something out there to continue to push them to move on. Something to look forward to, something that you could call a reward or a hero bonus, however you want to term it. So to honor the work that these folks have done and to encourage them to continue in their employment, I'm going to be in the next 7 to 10 days sending a recommendation and overall framework to the General Assembly to use $400 million in the upcoming American Rescue Plan Act dollars to be dedicated to essential worker bonuses, each of which individual or for individuals that have worked what will then be all 2 years that we are dealing with this pandemic. This is the grocery store worker who has been stocking the shelves from March 6th of 2020 all the way through when these dollars would be available at about that time in 2022. It's all these healthcare heroes that we are seeing that have been sticking it out, that have been staying in these hospitals working hard, that we'd be able to look them in the eye and say, you deserve some of these ARPA dollars. Stick it out. Don't go with that traveling agency. Make sure that you stay the course, help those in your community, and there will be a reward at the end. And I say a reward, but this is more than earned. Our EMS and our firefighters and our police officers who couldn't take a day off in the midst of this, our factory workers working for essential businesses. You know, you all have toiled it out, and I know you were scared, but you still showed up. This is something that when we send to the legislature, we are going to ask for cooperation and the formation of a working group that would include legislators or their staff, as well as executive branch staff, to go through the who and the how much to make sure that we do this right based on our experience, and that we hear from and listen to different groups, including legislators, from what they have been seeing in their district. We believe that this is a positive step and would be an effective plan, because as opposed to providing bonuses through other means right now and having people quit or leave after they got it and go on to something else before this pandemic is over, the idea that those dollars are there for everybody who sticks it out for 2 full years is something that I think that all of us as Kentuckians should support. There need to be a lot of details that get worked through, and that needs to have a lot of collaboration, and we hope cooperation. So again, right now, we'll be working on a framework to send. Listen, there's going to be a whole lot to be fleshed out, because we wouldn't want every decision within it to already be made. And in the end, it's the legislature that has to appropriate these dollars that will put any final decisions into print. I look forward to working with them. I hope that this request for coordination and cooperation is well taken. And these are dollars that are going to be right there next year. And this is one of the top uses that the federal government put out for us. So a lot more in that as we move forward. Let's go to vaccinations. The way we get fully beyond this, let's make sure by March of 2022 that everybody's vaccinated. Over the weekend, and the federal database is having some discrepancies at the moment. So we've gone in the most conservative numbers that we have seen, as they bounced around a little bit today. Over the weekend, 17,125 new Kentuckians vaccinated with at least their first shot of hope, bringing the total to 2,719,398. Woodford and Franklin County each at 78%. Fayette 75, Campbell 74, Boone of 72. Now, each Monday we look at this both demographically and geographically. So there's our new number, 2,719,398. That now represents 61% of all Kentuckians have had their first shot. Folks, we have to do better than that, but it's incredible how quickly this has happened. This is less than 2 years from the very first case that we have had of this brand new virus, and we have vaccines. And 61% of everybody, even though everybody is ineligible, has already gotten at least one shot. So of the eligible population, 12 and up, 71% of those individuals have gotten the shot. Remember, early on, people thought if we got 70% of people vaccinated, we might reach herd immunity. It's just the Delta is more aggressive than that. And then when we look at individuals that can make their own choice, don't need a parent to sign off on it, 18 and up, now up to 74% of all Kentuckians. Now, the federal database has made a change where they've broken out the oldest Americans in an extra group. So last Monday, we had 65 and up, and that was 92%. But they've now broken it out to 75 and up, where we are at 90%. That means 10% of all individuals 75 and up are unvaccinated. We need to get every one of them the shot. 65 to 74, actually a higher rate at 95%. That's incredible. So this age group, 65 to 74 in Kentucky, has done an excellent job of getting out there and taking at least their first shot of hope. 50 to 64, up 1% now to 81%. Now, given the Delta variant, we made two changes today. One is breaking out that top age group. The other is we were showing green for percentages vaccinated that aren't enough to beat this thing and aren't enough to necessarily be celebrating. So now our threshold for reaching green is going to be 80%, which is where we need each of these groups to get. So we're going to dip down into the yellows, 40 to 49, up a percent to 71. Listen, 71 overall is where we are at 12 and up. But if you're 40 to 49 like I am, it's your age group that has started dying, that wasn't previously dying in this pandemic. So please get out there. Let's reach that 80+% threshold. Let's do our part to make sure that in our prime years of being a major part of an economy on fire, we do our part to make sure we defeat this pandemic and move into prosperity. 25 to 39, still 60%. 18 to 24, 52%. 16 to 17, 51%. And 12 to 15, 46%. So we were able to break that out a little bit more. Remember, we just got 12 to 15 most recently. 16 to 17, we broke out because that's only Pfizer that has been eligible there. So a little more data there, but listen, 12 to 24, we can do a whole lot better. Almost every other individual in those age groups has not been vaccinated. All right, geographically, we do have a number of counties moving into the above 50% of their community vaccinated. It's not enough, but let's celebrate the progress and then let's push for more. So good job to Fleming, Breathitt, Estill, Pulaski, Caldwell, and Grayson. Again, 50 is not enough, but keep it up. Upward movement is upward movement. Good job. Let's continue to push. And today, one new county above 60%, Nelson County. Again, good job there. Keep going. Even 60%, not quite enough. All right, October is going to be a huge month in terms of vaccines, boosters, etc. So two major things going on this month. October 14th and 15th, the advisory committee will discuss booster doses of Moderna and the Johnson & Johnson. We put Janssen up here. That's the same vaccines. This is a big deal. A whole lot of us, including me, has taken Moderna. And unless you are immunocompromised, right now there is no authorization for that third Moderna shot. So they'll be talking about that. Moderna does appear to have created the most robust immune response and thus the best protection against the Delta variant. I don't think that's questionable now. So if you've taken Moderna, you're still probably in pretty good shape. But all of us, I think, at the right time would like a booster to stay in good shape. Janssen, the Johnson & Johnson vaccine, that's a different story. I mean, if we had to rank what we think we see as effectiveness, Moderna being the best, Pfizer being the second best, and Janssen being in third, we really need this booster. So looking forward to what we're going to see October 14th and 15th. What we're likely to see is who would be eligible for a booster and at what time would they be eligible for that booster. But I do want to remind folks, this is the third shot, right? This is the third shot of Moderna and the second of J&J. But again, this is not the immunocompromised piece. If you took Moderna and you're immunocompromised, you can go out and get a third shot, and you should right now. J&J, you don't have that option. I know it gets complicated. Remember, Pfizer, already you can get a third shot if you're immunocompromised or if you're over 65, or if you have certain health conditions, or, and we're going to get there, if you're in certain professions. But this is Moderna and J&J. All right, October 26th. It's a big day for parents like me. The FDA anticipates the advisory committee will discuss authorizing the Pfizer vaccine for children 5 to 11 years of age. I believe where our numbers are in Kentucky, if we can make a big push when this comes out, as well as kids a little up, we can make some game-changing gains against this virus. I mean, once we have just about everybody able to get vaccinated and we continue to press, then not only do we have cases going down now, but then we could be in such better shape. And I got to tell you, as a dad of an 11-year-old daughter, I desperately want this day to come, and so does she. All right, so we talked last week about Pfizer, and it gets a little complicated again, because if you're immunocompromised, you can go get your third shot of Pfizer. If you're 6 months after your second shot and you're over 65, go get your third shot of Pfizer. If you have those health conditions that we talk about, heart, lung, kidney, BMI over a certain level, and it's been 6 months, go get your third shot of Pfizer. So those were the things that were set out. But now there is another one that the CDC has given us. If you are a part of professions that you have a lot of interaction with people and the public, and it's been 6 months since your second shot, go out and get your third shot. These are first responders, healthcare, firefighters, police, congregate care, really big for our healthcare heroes because they almost all got Pfizer as it got here first, and it was coming in and they had access to the cold storage. So we need them to do that. Educators, just about any educator, because we put them at the front of the line, that got Pfizer should be eligible for their third shot now. Educators, you should go get it. We've already lost more than 50 amazing souls in your profession. We don't want to lose any more. So give you a good protective boost if you took Pfizer. Remember, if you took Moderna, we're going to find out in October when we might be able to get that booster. That would be you and me both. Food and agriculture workers. You work, you stock grocery shelves. You're going to interact with a lot of people. Go get your third shot of Pfizer. I have an uncle who qualifies in 2 categories that are eligible. He's been able to go get it. And I think we're going to celebrate his birthday tonight, and we'll celebrate that third shot too. Manufacturing workers, corrections workers. There's a lot of interaction there. U.S. Postal Service workers, public transit workers, and again, getting back down to grocery store workers. So those are a lot of updates. We'll have all this up online. Just do your best to understand it. Call with questions if you have it. We want to make sure everybody understands when they can get their booster. All right, so recently we've talked a whole lot about how we need to get more people vaccinated, but recently it's been really important to recognize the really hard work that's been put in and about how we are doing a whole lot better than most. I'm proud of Kentuckians and their efforts. I wanted to put that into context compared to our neighbors today. So this is a percentage of the population that is eligible, right? 12 years and up in each state that has received at least one shot. These are all of our neighboring states, and we are third amongst every state that we connect to. Yes, we trail Illinois and Virginia, though you will see there is a category we're real close to Illinois, but we are 8 to 10 to, in some instances, 15 percentage points above most of our neighbors. Listen, these are areas that we often share similar culture with. This is effort. This is pure effort of our people from the start, pushing as hard as they can to get as many people vaccinated. I'm pretty proud of where we are compared to neighbors both to our north and to our south. Let's look at it in a different way. This is for folks 65 and older, so we smushed that category back together that we separated today. But this is of the most vulnerable Americans to COVID-19. Where do we place? Again, third, better than most all of our neighbors, but Illinois and Virginia, and really close to being second amongst that group, leading so many to our north and again to our south. I am glad though, because we're all Americans and we should care about everybody in every state, that everybody's numbers, all of our neighboring states, that their numbers of vaccinations are up in this area. And guess what? We all have cultures where we are taught to respect and listen to our elders. Our elders are showing us you should get vaccinated. And then let's look at fully vaccinated, right? This is one where we continue to push to make sure everybody gets at least the 2 shots, and that's what this is. As you can see here, very close to being second amongst all of our surrounding states. That does not mean that there isn't more work to be done, but we need to give an attaboy and attagirl to so many folks across Kentucky who are showing up, even when they put up a tent and 3 people show up to get vaccinated. They've just protected 3 people from the deadliest virus of our lifetime. So everybody involved in the vaccination efforts, keep going. Your work matters. You are really performing. We just got to keep it up. And on another good note, meeting with senior vaccination official with the White House, Kentucky's recent vaccine trend higher than much of the rest of the country. We have not, when we had our decrease, we plateaued, and we have been either increasing or holding steady ever since. It's been noticed. One more piece that I want to point out, and then we will turn to questions, and that deals with pregnancy. 2 pieces here that we want to make sure we pass along the data and the science. It's number one, these vaccines won't, can't make you sterile. There's a lot of people out there who are younger who want to have kids. I get it. They changed my life forever. It is incredible. They are miracles. I really want you to have that moment or moments of bringing those incredible children into the world and then caring for them and raising them into incredible adults. This will not stop you from doing that. If you don't get vaccinated, though, it makes it less likely you'll be around to have that opportunity. Also, we have seen folks, based on misinformation, not getting vaccinated if they are pregnant. It is now absolutely clear that if you are pregnant, you need to get vaccinated. Look, of 125,000 pregnant persons that have tested positive for COVID-19, 22,000 have been hospitalized, 161 have died. 97% of everyone pregnant and hospitalized for COVID-19 has been unvaccinated. What that says is care for yourself, care for that baby, make sure that you get vaccinated. It's the right decision. All right, with that, we have about 8, about 8 journalists. 3 are here today. 5 are with us virtually. We will start with Tom Latek.
Third on the list, so I was just kind of,
Man, they got you first here.
Oh, okay.
That's how they hand it to me, Chad.
Yeah, no, okay, I'll go this way. I've got 2, if you don't mind. First of all,
Should call on somebody else.
you have to call a special session for the $400 million ARPA appropriation.
Yep.
And secondly, have you heard anything new about the federal help for the EMTs and the nurse strike teams that we had from FEMA and other federal agencies? Have we got the extension on that or expansion?
So the ARPA dollars won't be available until we are in regular session in the coming year. And when looking at a bonus that or a reward payment or just deserved compensation, to be able to set it out, knowing that we would pay it at a time when hopefully we were in a much better place and hopefully getting done with this, keeping people in those jobs we need to keep them in for the entire time, I think is optimal. And again, there's a lot of details to work out, but no special session would be needed. I believe we still have all of our EMS strike teams. They have been really effective. The nurse strike team has left St. Clair. I believe it has been moved by the federal government. I do need to get an update on the other one that we had come in. I want to say Taylor Regional, but I need to check that to make sure of its accuracy. We also have teams in for monoclonal antibodies, and they are here. We don't know how long they're going to be needed because in a very good sign, with the number of treatments being requested dropping, we may not need them as much as other states do. Chad.
In terms of the hospital rates and things, any kind of idea of when it could get to the point where hospitals are not in the overrun capacity that they are in?
So the question is, when will hospitals get to the point when they are not overrun again? Can we put up the chart of the inpatient census? I think the answer is it all depends on how severe the downward slope of this line is and whether or not it levels off at some point. So if you look at our previous highs, that was a manageable point where some hospitals had to cancel some procedures, but not many. Now, staffing has changed since then, so it may be some level somewhat below, but as you can see, we're approaching that level. I would say we need to, if it continues at this pace, hopefully a month or less. You know, we thought it might be a month last week. But certainly hospitals are starting to see it too. We haven't had requests for ventilators, for instance, I don't think at all in the last week, which is incredibly positive.
Really fast. In terms of seeing this rate, are you kind of starting to take a deep breath? Do you think that we're at that point, or do you still think we should? A little bit longer?
I worry every day about our hospitals, and we still need to worry for them. We still have a whole lot of people dying, but we can see the light at the end of the tunnel, and we can see where there's going to be relief. What it means is this absolute state of critical emergency that we have been in looks like it will end, and that we will not continue, the coming months at that level in this pandemic. And if we all get vaccinated, we'll never be back there again. And I certainly do think it has pushed more people to be vaccinated. And so my hope is with that, with the number of people who have gotten the shot, with the number who will get it when they are eligible, that we won't see a spike like this again. I mean, we've now had both St. Louis and Philadelphia in the course of this pandemic. Mike.
Given the lingering staffing shortage, are you open to the idea of possibly allocating some of the $400 million ARPA funds to use as an incentive to attract healthcare workers from outside of the state?
We could be, well, let me back up. First, we would have to see, the question is whether I'd be open to using some of the $400 million of ARPA funds to attract healthcare workers from out of state. Number one, we'd have to see if that's an allowable use of it. I know an allowable use is thanking those essential workers that have been on the front lines. We'd have to look pretty carefully at that other piece. The second part is I do want to make sure that we don't start an arms race with other states that also need their people, that we are able to work cooperatively there. Now, there are lots of things that we can and should be doing to address shortages that existed prior to the pandemic. We need to have larger classes in our nursing programs. We need more flexibility on how instruction is provided. And we need to do that pretty quickly. I think we need to continue after the pandemic to recognize credentials of healthcare workers from other states and not create impediments to them coming here and being able to practice. And then I think that we have to look like we did at doctors at one point at foreign-born nurses. There are a number of countries that we could work with on visas and others. It's certainly something we use to address doctor shortages with amazing community members that originally came over in those programs and now are just leaders within communities ranging from Eastern to Western Kentucky. So I do believe that there is a lot of desire to address some other regulatory issues that may hold us back. And I think we're going to see a lot of that during the special session. Stu Johnson from WEKU.
Thank you, Governor. Kind of a twofold vaccination question. The 18 to 24-year-old category, in the chart you've showed today, is 52%. First question, I guess, is why do you think it's there? That's as high as it is at this point? And then secondly, how optimistic are you that vaccinations will increase enough to ward off what could be the next variant?
So 18 to, and can we put that back up on the, yeah, so the 18 to 24-year-olds, we pushed hard to get this group vaccinated. You could look at it in two ways. One, you could say not nearly enough, and it's not, to protect this age group from the current variant, much less than the next one. And we are seeing people in their 20s, if they are not dying, getting really sick and having long-term consequences. If you're 18 to 24, maybe you were invulnerable early in the pandemic. You are not now. And I think that is getting out there more and more. I do think what helps in this age group is what you can go do and not do depending on whether you are vaccinated. I think if a major sporting event required you to be vaccinated, this is a group that would do it. I know Louisville's Railbird Festival, when they collected information, you had to be tested within a period of time, or you had to show your vaccination status. They could track, and they're going to send me the data, how many people got vaccinated in, say, the 6 weeks leading up to it. And I mean, for them, that's a heck of a reward. And those are some of the things that I think we need to look at here, maybe even putting on things for that group. This is a group that, man, at this age, you really want to socialize. You don't really want to social distance. So if we can create opportunities where people are or have to be vaccinated and then can do that. I mean, if you're vaccinated and you're outside at a bar, that's a whole lot safer than if you were unvaccinated, especially indoors. And then the second question was, it is so hard to know. This Delta variant is rougher than anything I thought. Well, it's not rougher than the initial projections for the virus. I remember looking at those as we were all trying to keep calm, myself included. And I had to tell myself to breathe on a number of days looking at those. I really think it is a race to vaccinate. No matter what variant comes next, if we are significantly vaccinated, it won't have the same impact. It simply will not. So whether it's fully defeating the virus, which I think may well happen, or whether it is getting enough people vaccinated, and then if we have to be on a schedule, just like we are with the flu shot, to be able to live with this thing without masks or anything else, I do think we're going to get there. The question is, are we going to get there before a rougher variant comes, and then preys on the smaller group of unvaccinated Kentuckians, but perhaps in an even deadlier way than our current variant? Karen Czar, WKY.
Thank you, Governor. Governor, several school districts and private schools implemented mask requirements with the caveat that they were going to look at the numbers and revisit their mandates during fall break, which a lot of them are getting ready to go into and possibly adjust. Are you worried that as numbers fall, as we've seen in other surges, that there becomes a false sense of security? And what should they and parents and guardians be looking at in making all these decisions moving forward? Thank you.
So our case numbers are still way too high. They are higher than all of the previous surges that caused us to rightfully make really severe decisions. Now we know we don't have to if we get vaccinated and we mask. Every school system, for the time being, should continue universal masking because now we know and we've seen that COVID can spread and spread quickly through schools. It was a myth that we all wanted to believe that it would somehow stop at the doors of that school. We've now lost over 50 educators that are no longer with us. And so we should continue to do the masking, both because cases are still too high, but also we don't want to shut down. We don't want any school to have to send the kids home, is what I mean by that. And this gives us our best chance. Now, it's possible that we can get numbers down eventually. It's not likely in the next 2 or 3 months, and it's probably after 5 to 11 can get vaccinated, where we may be able to do other things safely, but we are not there, and undoing masking in schools would pop our numbers likely right back up, or it would at least slow the decrease that we desperately need. So I think every healthcare worker needs us to continue to do it. Every parent that wants their kids in school, needs to support it as well. Sarah Ladd, the Courier-Journal.
Yes, thank you. Regarding the bonus plan, have you already discussed the idea with Stivers and Osborne? And then secondly, real quick, if I may, is there new Halloween guidance for this year, or will there be new guidance released soon? Thanks so much.
We don't have new Halloween guidance out yet. And that's one I need to check with Dr. Stacks. Certainly the CDC put out guidance. If you're planning ahead, outside, much better than inside. If you're inside, you really want to be wearing a mask. If you can make it as contactless as possible, then good. I mean, we got really innovative during Halloween last year, where people could set out candy on a table, still smile and wave. That keeps the kids safe. It keeps you safe. Have not had a chance yet to have a discussion with legislative leadership. This is something that we have been trying to crunch the numbers to get to, but I look forward to it. And as you notice, we haven't fleshed out all pieces because we want cooperation, collaboration, and contribution from those involved. So even if people are pause in the beginning or have questions, or even if they're skeptical, let's sit down and let's figure out what we can come up with. Certainly, there's a lot of hard decisions within it, but there's a lot of really worthy people. And I think this is another way of getting at what some legislators have mentioned and wanting to keep folks in healthcare and stocking our grocery store shelves and others. So let's talk about this option. Melissa Patrick, Kentucky Health News.
Hi, Governor. Have you had any updates on the test to stay programs that a lot of schools are doing? And are there enough of the rapid COVID tests in Kentucky right now for everyone to have what they need?
Let me get an update on that for you. There's no way that there are enough rapid tests for every school system, especially the largest ones, to be able to do that on a daily basis. And the most popular brand of the rapid test was the least popular early in the pandemic. I think schools are doing a good job. I think that they are trying hard. The challenge is having enough personnel to test, depending on how big your system is, and then having the tests themselves. But that has not been thus far the major limitation. I don't think we've really seen results back fully yet. And certainly there are some areas that's important to point out that COVID's still overwhelming at a level that you cannot do test to stay. And we've seen some schools out for at least a couple days moving into fall break. Do want to point out the test to stay doesn't work without universal masking. And that is regardless of where the COVID level is because of how quickly the Delta variant can spread. Michael Payne, last question with the WKU College Heights Herald.
Good afternoon, Governor. A month ago yesterday, Med Center Health in Bowling Green announced in a press release that they were firing 180 employees after not complying with the hospital's COVID-19 vaccine requirement mandate. That represents about 5% of their total staff. Now, they said that they have replaced the fired staff, but are still receiving support from the National Guard and FEMA, apparently due to staffing concerns. My question is if they had the ability to add 178 new members of their staff, one, do they really need the federal and state support that's there? And then two, do you believe that firing clinicians while also seeking assistance is the best way to handle this situation? Thank you.
I fully support Med Center and every other hospital system that required their workers to get vaccinated. When you look at the exposure that people are in to this virus when they're in healthcare, you cannot keep your workforce healthy without them being vaccinated. I also have concerns about a healthcare worker that has bought into the misinformation being the person that's looked to when someone visits that hospital on vaccines themselves. Listen, it was a hard decision, but I think ultimately it was the right one. And I think a whole lot of the unvaccinated healthcare workers were going to end up really sick and not working. Yes, I'm happy to support with the National Guard. Obviously, the influx of patients would be there even if there were 100 more staff members. But the idea that many of those staff members wouldn't be sick, I think, is false. Tough decisions have to be made, and they stuck to their word, like other hospital systems did. And I know while we focus on that number that you put out, the 100 plus that ultimately were let go, just think about the number of people who ended up getting the shot because of that are now protected. We're seeing employers outside of healthcare do it too, and to them, it's a workforce issue. How if you have a big factory floor and folks aren't vaccinated, do you make sure that you can have enough people for each shift when the Delta variant can come in and fully wipe folks out? So again, still in a tough spot for the number of Kentuckians we're losing. And we're going to see a lot of deaths in the coming couple of weeks because, again, deaths follow cases. They are kind of the furthest lagging indicator, but really good trends in especially our positivity rate and number of Kentuckians that are hospitalized going down. Let's make sure that we push hard to get to a better place. Have those tough conversations with people you love that are unvaccinated. I believe that is working. And when you are out in public, but indoors, put on that mask. It's going to protect you and everybody around you. Thank you, everybody.